Welcome to A Guide to Using High-Frequency Nasal Cannula in the Home Care Setting by Amy Joyner, RN. What is high-flow oxygen therapy? High-flow oxygen therapy is a form of non-invasive respiratory support that provides heated and humidified high-flow oxygen. It can deliver precise oxygen between 0.21 and 100% oxygen at flow rates up to 60 liters per minute. Typical nasal cannula delivers between 2 and 6 liters per minute. High-flow nasal cannula can reduce the need for CPAP by providing positive airway pressure. In addition to providing a high concentrate of oxygen, the heat and humidity added to the oxygen can decrease airway inflammation, improve mucus clearance, and reduce caloric expenditure. High-flow oxygen therapy can reduce a child's work of breathing. Benefits of the high-flow nasal cannula are the heated and humidified air. It provides heated and humidified gas. Inspiratory demands. It can better meet elevated peak inspiratory flow demands. Functional residual capacity. It increases the FRC, likely due to a delivery of PEEP. It's lighter, more easily tolerated than CPAP or BiPAP. It can minimize oxygen dilution by meeting flow demands, and it provides high flow rates leading to wash out of pharyngeal dead space. Benefits to the high-flow nasal cannula versus a regular nasal cannula is there is a 25% increase of functional residual capacity. Also, there is minimal room entrainment and greater oxygen delivery. There is less oxygen dilution, and the patient will be receiving the precise amount of oxygen needed. What conditions benefit from high-flow nasal cannula? Pneumonia, asthma, bronchiolitis, chronic respiratory distress, respiratory failure, and COPD. How do you care for a patient on high-flow nasal cannula in the home care setting? First, check your high-flow nasal cannula setup when you get to the home to make sure it is functioning properly. Is it in good working order? Are your oxygen tanks full? Is it plugged in? Check your MD orders against what is being given. Call the office or your clinical supervisor if there is a discrepancy. Assess your patient's respiratory status according to the 485, the plan of care, and more frequently as indicated. Assess for abdominal distension. Keep the high-flow nasal cannula tubing off of the skin, as the tubing can get warm and cause irritation or worse. Check for pressure areas and redness where the tubing must be against the skin, the face, and the nose. Keep the nares clear. Suction the mouth and nose as necessary. High-flow nasal cannula works best if patients' mouths are closed. However, this is not always possible. The Airvo 2 is a common high-flow nasal cannula used with home care patients. For instructions for use, resources, and education, scan the QR code and download the Airvo app today.